Executive Secretary of the Sakina Medical Outreach, Mr. Kazim Akindumbi. Mr. Kazim, if you can hear me, over to you and salam alaikum.
Assalamu alaikum assalam wa rahmatullahi wa barakatuh. Distinguished guests, facilitators, and members of the Sakina Medical Outreach family, good morning and assalamu alaikum to you all. SMO Talk, Sakina Medical Outreach Egg Talk, is scheduled as a quarterly program. We have done for Q1, also for Q2, Q3. And today's session marks not only for Q4, it is also the final egg talk for SMO for 2025. And if you are with us from the beginning, right from Q1, we observe that all the sessions we have had are all power-packed ones, and they were all handled by experts in the field. We are confident that today's speaker will also do justice to the topic, which is hidden dangers in our communities, the rising threat of hypertension and diabetes. Our guest speaker for today's session is also an expert, and I think you will testify to that when his profile is being read by the host soon. So we are grateful for you all for your continued trust, participation, and support in our work. So thank you so much and happy listening.
Thank you so much, Mr. Kazim, the Executive Secretary for the Sakina Medical Outreach. Thank you. Earlier on, I said 2029. I'm already seeing the future, but inshallah, the Sakina Medical Outreach will go beyond 2029. You know, I'm talking about 100 years to come. The Sakina Medical Outreach will still be here. The Sakina Medical Outreach was actually established. It was launched in 2009 or 2029, I beg your pardon. And I just want to also say that so far in 16 years, at the Sakina Medical Outreach, we've spent over 200 million naira. SubhanAllah, that's a lot of money. And you know, we can't talk about how much we have spent or the impact we have made without thanking our donors and our sponsors. So for those who have supported the incredible work that we do, we say thank you. Jazakumullah khairan. May the Almighty Allah continue to bless and enrich you. And for those who are not Muslims, who also support the work that we do, thank you so much. Thank you. You know, you do important work by strengthening us to provide free medical outreaches and free medical solutions and interventions to people who truly need them. Thank you. So more than 2,219 surgeries. Again, we've done more than 2,219 surgeries, subhanallah, with over 12,000 Nigerians of all backgrounds. I mean, I said earlier on that we do not discriminate at the Sakina Medical Outreach. So whether you're Muslim or not Muslim, provided we can verify what is happening to you and we have the necessary resources to assist, we will ensure to assist you. So really, thank you so much for your kind support, for your donation, for everything. And like Mr. Kazim said, we can't be Sakina Medical Outreach without you. So really, thank you. And we know that we can't say thank you enough. Now we will go to why we're here today, you know, to talk about the hidden dangers in our communities, the rising threats of hypertension and diabetes. Like Mr. Kazim said, every time we talk about different topics affecting your health or that could affect your health, we bring seasoned professionals, you know, not okay, this person just no. We talk about persons who have been in the field for many, many years, individuals with track record, people who know their onions and they are doing amazing stuff in their different capacities. So today we have the honor and privilege of having in our midst Dr. Mohammed Mustafa I'm just going to read an abridged version of is bio to you? Because if I say, let me read everything, we're not going to leave here today. That's for you to know the kind of person that this man is. Dr. Mohammed Mustafa Yakubu is a seasoned consultant, cardiologist, and physician with extensive experience in clinical cardiology, internal medicine, and emergency care. He currently serves as the head and supervising consultant of the Medical Emergency Unit at Ahmadu Bello University Teaching Hospital Zaria. He is actively involved in medical education, leadership development, and community based health advocacy. He has qualifications and certifications in Bachelor of Medicine and Bachelor of Surgery from the prestigious University of Ibadan. He has certificates in leadership and management in healthcare, certificates in epidemiology, certificates in hospital. I can go on and on and on and on, but I can tell you that if I do go on and on, we will not leave here today. Thank you so much, Dr. Mustafa, for taking out time out of your busy schedule to be with us this Sunday morning. Assalamu alaikum. Assalamu alaikum to you, sir. So if you're speaking, we can hear you. Your microphone is muted.
Wa alaikum assalam wa rahmatullah wa barakatuh. Good morning, everyone. Thank you very much for hosting the program.
Good morning, and thank you most kindly for deciding to be a part of today's edition. You know, we know that doctors are busy, and I always say to my parents and my siblings, in fact, we still discussed it, I think 2 days ago, that doctors are lifesavers. When others are going on holiday, you know, doing Owambe and just getting the December, you probably have a call that there is an emergency and you're in the hospital. Thank you so much for the invaluable work that you do. It is priceless. We can't thank you enough. Thank you. And out of the busy schedule, you still said no. I love to educate people, and I will be here this morning, and that's why you're here. So thank you so much, doctor. Thank you. Let me start by asking you, how are you doing? Because I'm not sure doctors get a lot of this question every time. How are you doing today, sir?
Alhamdulillah. Doing fair. We thank God.
Good to know. Good to know. So let's
Yeah.
go to the discussion of the day. And my first question to you will be about how, you know, a lot of people, they feel fine and they just assume they're healthy. How can hypertension and diabetes quietly damage the body long before the symptoms appear? And why is this silence so dangerous?
Yeah, thank you very much, host. Going straight to the point, hypertension and diabetes, they are chronic diseases and generally asymptomatic for the bigger part of the initial process. And because it can affect individuals without them knowing, we usually term them as silent killers. Hypertension, simply defined, would say a measured blood pressure greater or equals to 140 millimeters of mercury all over 90 millimeters of mercury. The 140 will say systolic, the 90 will say diastolic. Of course, there are other definitions. The Americans believe we should start from 130 over 90, but we Nigerians, we still stuck to 140 over 90. So blood pressure sustained, measured at that value is systemic hypertension, or what we call elevated blood pressure. This measurement comes with accompanied symptoms. Some of them are very mild, you know, some totally asymptomatic. I've seen a patient with 280 over 140 with no symptoms, overt symptoms. What they do is to destroy silently and then come out at a single blow. But thank God, in majority of people would have symptoms. There are symptoms. Some will come with slight headache, some will come with frequent urination, some will come with tingling sensation, some will come with vague chest pain, some will even come with general fatigue. And they will complain, I'm not feeling too good, but they would not think of hypertension or diabetes. Diabetes, this we describe as it's a constellation of symptoms of diseases. Actually, when we say diabetes, generally the simple thing the general public understand is elevated blood sugar. It goes beyond that, actually. But simply put, elevated blood sugar measured at different times or with symptoms. If with symptoms and then you find an elevation in either what we call the fasting blood glucose or what we call the random, then, or now what we call the glycated hemoglobin levels, then of course the person is defined as diabetic. Generally, it's 126 milligrams per DL, what we call 7.0 millimoles per liter. In our own definition for Nigeria. In some other climes, now it has gone lower to 6.0 or 6.5. But we still generally teach our students 7.0. That is 126 milligrams per DL for fasting. If it goes beyond these or at that level or above, then we say the patient is having elevated blood sugar or glucose, which we call it, but the community, the people know it as sugar. So if you tell them glucose, they get confused. So elevated blood sugar, because we're talking to the masses and we should communicate them with what they understand.
Absolutely.
What do you say?
I said absolutely.
Exactly. So talking about blood sugar. So when it goes at that level, then it begins damaging the body. So, but why it is dangerous is because it can do this without you knowing. Because if you do not present yourself to the hospital or health centers, or you are lucky to have an outreach taking place around you, inviting you to come for general checkup, you would not go there because the number will not be singing. You're not going to see it in your front. So it's something hidden. So you don't know. Until you are measured, nobody would know. And many times in Nigeria, like us, problems are usually originally spiritual in Nigeria or cultural. So probably traveled home last week and then started feeling headaches. You say, these people have finally caught up with him. So he would not go and check blood pressure. Blood pressure wouldn't be the first thing. The first thing would be to go for prayer warriors and then or herbs. And these are usually the things that lead to complication.
Yeah, doctor, you've said it all. Nigerians are deeply, deeply spiritual people. And when we should be seeking medical attention, we are blaming our village people, saying they have come for us again. Hopefully things get better. And that's one of the reasons that we do sessions like this. So we can use the opportunity to educate as many people as possible. Doctor, you talked about a number of things that stood up for me, but I think very importantly, you talked about elevated blood sugar. And you know that thing you said that, oh, what's speaking to the masses here, we have to come to their level. It is very important because on sessions like this, we have individuals from all walks of life, and we want them to leave the session feeling very happy, very fulfilled that they have used their time and all the resources judiciously. So please, doctor, you have to come to our level because I'm also not a medical professional myself. Well, that's just an aside. I'd like to, before I ask you the next question, I'd like to very quickly acknowledge some very important dignitaries in our midst today. These persons are the engines, for the Sakina Medical Outreach. And we just have to say thank you to them, Jazakumullah Karam, because we know that what you're doing is Lillahi wa Rasulihi. It's not as if they're getting paid, per se to do this. It's voluntary for the most part, but they know that this is important work, and if they do not do it, there will be a lacuna somewhere. So I want to say thank you and good morning and salamu alaikum to our executive chairman at MPAC, Mr. Disu Kamor. If you can hear me, sir, just say salamu alaikum to her. Okay, maybe we'll talk to us much later. I'd like to also say good morning and salam alaikum to Alhaja Rahmat Egbeyemi. She is one of the members of the Advisory Council for the Sakina Medical Outreach. Thank you so much, ma'am. You're always with us here. Thank you. Good morning, ma'am. Okay, maybe she will also talk to us much later. And for now, the last but definitely not the least is the chairman of the Sekina Medical Outreach. I talk of no other person but Dr. Salma Yusuf. Thank you so much for also being a part of this and for your leadership. I talked about the statistics earlier on, what Sekina Medical Outreach is doing for poor Nigerians who are in need of medical support. And you can tell that these numbers are only achievable when there is solid leadership in the organization. Really, thank you and thank you indeed. So, Doctor, back to you. You talked about elevated blood sugar, and I really like what you said regarding measuring. Because the truth is, even in our everyday life, it is important that we measure. If you do not measure, you cannot know how far you have gone. And that is the same thing that is applicable to our health. We need to know what is happening and not just wait until there is a free medical outreach. I know that things are really hard, but Almighty Allah will provide for us. So please, just try, every now and then try to measure your blood level so you know what exactly the challenges are. And like we always say in Nigeria, that prevention is better than cure. So the next question, doctor, is let's talk about the everyday habits in our homes and our different communities. There are some persons, for instance, who will tell you, if I'm not taking a bottle of Coke in a day or even 2 bottles of Coke in a day, I can function well. We also know people that when you want to take, say, for example, a half cup of gari, they put a lot of sugar in these things. So let's know the everyday habits, the everyday things that we do at home, especially with regards to food choices, sometimes also stress and inactivity that are unknowingly pushing more Nigerians towards high blood pressure and diabetes.
Oh, thank you very much, my host. There are a lot of things we do that we think it marks a level of enjoyment or a level of being enlightened or being an elite. You don't want to behave like the villager. You don't want to behave like the low class. The higher class is associated with more trouble. Just like the urban dweller is associated with more trouble because the choices we make actually decide how far we go. Excessive salt intake. I'm going to start with salt. We love salt so much. We believe salt is life. In fact, you see people educated telling people, whoever told you not to take salt is a bloody liar. In fact, one time there was one resource being distributed that one research was done in University of Tel Aviv, Israel, that says the best thing that can solve hypertension is to take large amount of salt. In fact, I remembered one of my patients saying he has visited Zimbabwe and he discovered that everything they take is salt. And I said, oh, mashallah. I said, okay, fine. Just inform your wife and your children tomorrow, take a good load of salt and then see what happens. If you hear Wamara Buka after the end of it, he said, what does Wamara Buka means? I said, that is the first greeting you will be told when you cross from Earth's surface to the greater beyond. They will ask you, who is your Lord? Once you hear that question, you know you are no more on Earth's surface. And he said, I said, okay. So you see, there are practical things. The African system, our blood system, the way Allah has created us, we respond more to salt. And that's what we describe or define our hypertension as salt-based in simple analysis, salt-based. So which means salt affects us a lot. So you take small salt, it gives you higher tension or blood pressure. So I tell people the amount of salt we consumed from roasted fish, roasted suya, meat, roasted this and that, and then we know you buy fish. Apart from those who make the fish, they've already add some salt. You add more so that it can taste well. We love good taste in Africa, especially Nigeria. It got to be very tasty. So we put salt. We add different spices that are also salted. Then we add different maggies that are also heavily salted. So you discover you have a complex of salt in your front. And then to worsen it, Then there is one white, small tubular structure. On top of the table, you still have granulated salt inside so that you can dust more salt on the food. Perchance your taste buds are not enjoying it enough. This is complex for destruction because the blood pressure would continue growing. You are enjoying your food, mashallah. Then the blood pressure also will thank you for allowing it to thrive, because blood pressure is also one of the creatures of God. So you are doing yours, blood pressure also will be rising. So we got to control our salt intake. It's a very common thing we do in our daily consumptions. Number two, we take a lot of caffeine. Caffeine filled things, so a lot of coffee, and other caffeinated substances. A lot of us take a lot of Nescafe, heavy doses of these things, very dangerous. Heavy Coca-Cola, very dangerous. These things contain a lot of substances that are not really healthy for the body. The amount of sugar in Coke is so high that if a good number of us would know the true value, the measure of the salt in these bottles, you would run. But we wouldn't run as Nigerians, because we always say, oh, alhamdulillah, that is what I'm looking for. so we wouldn't run. So because we don't know the implication, the consequences of taking such huge amount of these substances. These substances are dangerous to our health, though our tongue enjoy it a lot. So common practices, we take so much salt, we take so much Maggi. You see, some people, just to cook food for 1 or 2 people, they've added about 20 Maggi cubes there. And not only that, they still added salt to the same food, and they still added different categories of spices, salted, to the same food for one human being. And then it says it is the village people that made the BP to go up. And I tell you, no, it's because I did not rest enough. Yes, we'll come there. But you see, I'm making emphasis. I'm starting my emphasis on this as a daily practice that is very dangerous. Some will take 4 bottles of Coke in a day. When you take this amount of sugar, heavy loaded, it's going to stress your system. It's going to stress your system. And then with too much stress, of course, it's going to affect it. Simple language, simple explanation. And I tell people, reduce these levels of sugar. Other practices that we do that are dangerous to us include working throughout the day and night. We thought when God created sleep and said, we have created the night for you, your sleep, to be a source of repose for your body. You think it's a lie, that is not necessary. So you walk through the day, you walk through the night. And then you say, no, I can't cope. I need money. When you finally get the money, if you are lucky, you will use the money to manage the trouble. If you're unlucky, someone else will spend the money while you are at the other side giving account for the money. So which means we got to advise ourselves that as you age, I tell my patients regularly, you need nothing less than 6 to 8 hours of good sleep. Look at the politicians. When they are in meetings during the daytime and they fall asleep where they are not active, people joke them and say, can you imagine your president sleeping or your senator sleeping? And I say, oh, alhamdulillah, thank God for him. He never slept through the night. God has a way of saving the politicians. They are our leaders. So, okay, since he's not busy, he's just sitting down listening, then he sleeps. At least 5 minutes, 10 minutes, that helps him. But then you think it's a joke, it's too old, that is why he's sleeping. That man did meetings throughout the night. Then you expect him also to do another 12 hours throughout the day. It's not possible. And when you do that continuously, of course, it's going to accumulate a lot of stress, because sleep has a way of helping to detoxify the body. Sleep has a way of consolidating your memory, of freeing your body from inflammatory substances and others. So having good sleep is another important thing that we as Nigerians, we sleep by 1, we wake by 3 to continue hustling. These are dangerous things. So another thing, which is not too common among the general people in Nigeria, is physical sitting somewhere, not being engaged. That's not very common, at least from what I've seen. I said the high class people here, they sit down. In fact, those that sit down in Nigeria are usually, they sit down not because they have no job, they sit down because of their jobs. For example, auditors, administrators, accountants, you see them sit down long on table, not because they are not working, but because their job is either on the system, on the laptop, and they got to sit down there. And what I always tell this category of people is that when you sit down like that doing your work, after an hour, stand up, even at the same spot, you can make some various movements of your joints around your table, and then you can continue your work, or you move around. And I tell people it's a very big blessing for those that are Muslims that go for regular prayers, because that, when you hear the call of prayer, either you like it or not, at least if your heart is still working, you're going to move to go to the masjid to pray and then come back. That going out and coming back in helps your system completely, rather than sit for the next 12 hours, 16 hours, just working on the laptop, seated in the same place. These are things that are causes or increases the dangers that people face. But it will tell you I am working. Yeah, it's working. But is the work, does it involve movement of the entire body? The answer is no. And so that is one of the common practices that we involve in that is very, very dangerous.
Wow, Doctor, this is a master class. And I love the way you infuse humor into your teachings. You would notice that I've been smiling, I've been laughing because because really some of the things you said are quite hilarious. So, but really, thank you. This is what we do. What we do. It's not to sound overtly technical, because we know, like I said earlier, and we have people of different levels of education on the session, and those that would also listen to this much later on, and we want them to really learn, to get the message, and try as much as possible to inculcate what they have learned into their everyday habits. So really, thank you for simplifying the explanation. It's very helpful. You talked about a number of things, talked about salt, talked about sugar, and all the plenty maggies that we use, especially the Gen Zs and we the young chefs. We want to cook, we want it to be sweet and delicious. So we had all the spices in the world. We say our mothers, they're just very local. They use just Iru and all of those. But really, they are doing the right things, and hopefully we can learn from them. And you also talked about stress. And when you talked about stress, I just remembered a state in this country where they even boldly say that they never go to sleep. I know we all know the state. I'm not going to mention the name here, but really, stress it does more harm to our body than good. So nobody should stress. Nobody should take pride in having to wake up very, very early and getting to their various homes late at night. I know that it is not easy. May Almighty Allah make it easy for us. But it is also very important to prioritize our health, because ultimately, like Doctor said earlier on, if you make all the money in the world, you don't want to use that same money to start treating yourself. And what is the point making all the money and you don't have good health to enjoy the fruit of your labor? So please, as much as possible, try to get some rest, and like Doctor said, reduce the intake of sugar and salt, and try to also get engaged. Doctor, you gave examples of carbonated drinks, of sugar and salt and all of those things. But I also want you to please speak to persons who take fruits. There's some persons who would say, well, I don't do carbonated drinks, I don't do soft drinks, I do fresh juice. But when they're taking the fresh juice, they are taking a complete bottle on a go, and you see people like that, they take about 3-4 bottles in a day. Please talk to us about what those persons are doing to also harm their body, and even though they think they're taking natural juices, they're also causing harm to their body.
Yeah, thank you very much, host. Yeah, I'm going to come to that quickly now. Um, juice, fruits, and juice, I think I don't categorize them as belonging to one class. Juices that are produced by companies, industries, factories. Number one, a good number of them have very high level of preservatives. You don't even know what is being used for their preservatives. And number two, a good number of them are not really the fruits you think they are. And then number three, coming to the real fruits. If you have good fruits, there is also everything has measure. There is nothing that you should take in excess because it will also cause intoxication. We have water intoxication. You don't take anything too much because it is good. No, even when you take too much of the good, it becomes bad. That is why you only pray 5 times daily. If you decide to increase it to 20 times because you want to tell God you know how to worship well, it becomes toxic. And then that toxicity is defined as bid'ah. Yeah. So everything must be measured. So even in taking fruits, it must be measured. No excess is acceptable in anything. Secondly, part of the things we do, because the population here, though I don't expect us here to be smokers and alcoholics, but I got to mention it. I've also seen a good number of Muslims drinking different types of alcohol, working in alcohol industries, and then they take butters and all that. These are also detrimental to our health, and it worsens the burden of hypertension and diabetes. So, and the same thing, the smoking, it damages the vessels, and all these things contribute as a whole thing, because the pathology behind hypertension and diabetes is not just the measured sugar alone, not just the measured number alone. It has a complex network of different things affecting different parts of the body, same time, different time, continuously. And that is why all these things, even the good things, you must take them in normal measure. Normal measure, not excess. God does not love people who do things in excess, actually.
Absolutely. Moderation is key in everything we do. If you do it too much, apart from people coming for you, it would also hurt you as an individual. So
Yeah.
please, either you're taking freshly squeezed juice, like I like to do it in moderation. It is
Yeah.
very, very important.
Yeah.
Doctor, before I go to the next question, they just whispered something to my ears. And I said, no, this can't just pass. We have to congratulate you. So I was just told now that you've been elevated to the rank of Associate Professor of Neurosurgery. Mashallah. Congratulations, sir. We are very proud of you. You know, we need a lot of role models. We need Muslims who are role models, Muslims who are doing incredible work like you do. And you know, you're not just keeping this knowledge to yourself, you're sharing, and that's one of the reasons you're on today's session. So, this is very well deserved. Thank you so much for putting in the hard work, for the courage, because I can't imagine for you to be a doctor and now an associate professor and soon to be a professor, inshallah. Well done, sir, and congratulations to you. Please, if you can drop congratulations on the chat, help me do that. He deserves it. Congratulations, sir.
Um, I don't know if I'm going to say thank you,
And you have
but I
to say
think
thank you.
okay. I'm going to tell you why I don't sure I'm going to say thank you because
Okay, so please tell us.
I think there is a mix up here.
Okay.
I'm a cardiologist. I'm not a neurosurgeon. Yeah.
Oh,
So that's for my brother, not for me really.
oh.
So that's why I said I don't know. I'm going to say thank you, and that's not for me
Well, you
actually.
can thank you on behalf of your brother
Yes,
because
I'm saying thank you. Yeah, thank you for my brother, not me.
okay,
I'm a
that's
cardiologist. Yeah, I'm not a not a
that's
neurosurgeon.
fine.
Yeah,
That's
yeah.
fine.
Thank you
Thank
very
you.
much. Yeah,
It's double celebration regardless. I mean, your
thank
brother
you.
is also for you. So
Yeah,
really, please
yeah.
send our regards to your brother. And the person who told me it's you. Okay, they are seeing the future. It's coming very soon, inshallah. So doctor, the next question for you is on young people, right? Young adults specifically who are now being diagnosed with hypertension and diabetes. I know this should not be commonplace, but what warning signs should never be ignored, no matter the age?
Yeah. Thank you very much. You know, diagnosis number one has increased nowadays because technology has improved, awareness has improved. So a lot of things that in the past we say we don't see at social age, we don't see in lower ages, now has changed because now there are more hospitals everywhere, there are more health facilities everywhere. Before, in a whole state, you may only have maybe one or two centers where people have to travel to. So you got to be very sick before you go there. But now outreach is everywhere. Programs, support programs everywhere. People are told, "Oh, just come out, free service, just come and get it." So more diagnoses are being made. And so that is one of the reasons we are seeing more of these things. That's number one. Then number two, of course, there is family history. People who have diabetes in the family, they have a risk of having it. People who have hypertension in the family, in their parents, they have the risk of also being hypertensive. And then a lot of risk factors nowadays. And one of the risk factors I'm going to talk about, because of that state where you mentioned that they do not sleep, one of the very key risk factors now for hypertension is noise and pollution. Air pollution, noise. Noise now worsens hypertension. Yeah. So you people that stay in that state that do not sleep, you got to be careful with that. And those people who work close to blast furnaces, mining sites, this is also trouble. Then number three, if you're gonna see the youth of nowadays, they are much more active, much more involved in activities that the elders never did before. Now a 14-year-old boy wants to ride a Jeep, a 14-year-old boy wants to be a billionaire. And so he undergoes activities that the past people do not go through. Another thing is use of narcotics. You see young people and various forms of dangerous drugs that we call psychoactive substances. You see a lot of youths now being involved. Even they're going to tell their parents, no, I'm not involved in anything. But when you come close to them, you see them actually being involved in taking a lot of drugs. Drugs has become a major trouble to us. When we talk about drugs, we're not talking about medications. We're not talking about antihypertensive medications. We're talking about drugs, dangerous things. Now, a lot of boys, even girls, I've seen a good number in my clinic taking these dangerous things. And that is why more young people now are becoming, hypertensive, diabetic, and all other different type of chronic diseases. The signs you're gonna see, early signs, excessive urine. You're gonna see this frequent urination, excessive thirst. The individuals notice getting thirsty, of course, very common sign for diabetes. Frequent urination, unexplained weight loss, fatigue, and if he's able to go to any facility, then he finds high blood pressure or high blood sugar, as the case may be. So these are some of the very few signs that the individual may come with. I repeat again, frequent urination, maybe large quantity, generally larger quantity, not associated with pain in the organs of urination. Then excessive thirst, unexplainable fatigue, unexplainable weight loss. Then, if this person has access to measurement, high level of blood sugar or high level of blood pressure. These are the common signs we will find among young people.
All right, sir. Thank you so much for that response. I know we have young people on the call right now, and more will still listen to this later on. So it was important to ask this very question. My next question, and we need to move really fast now because we are a little behind schedule. The next question is on people who are already living with hypertension and diabetes. What common mistakes do you think worsen their condition? Even when they say, oh, we're managing it very well, what do you think they're doing wrongly?
A good number of them, they skip medications. They skip medications. That's one of the very common thing I've seen in a good number of patients. They skip medication. One, either due to I'm tired, taking drugs every day, medications every day. Two, I got to manage these medications. It must wait the drug must wait for 1 month, even when it should be that for 20 days. Three, poverty, poverty. And then four, just individual choice. I have seen patients who find it to buy a shrebi for weddings, but find it extremely difficult to buy medications for hypertension. So these are things that happen. So a good number will also believe that herbs can solve the problem. I remember many years ago, God saved my mom because having been diagnosed with hypertension, somebody went to and said, no, you can't be wasting your money on these drugs. Why just got snail water? And then they bought all the snails available and then squeezed the water. I went home and I saw a 4-liter keg of Brewer. I was like, you got water from the sea or where? He said, no, it is snail water. I said, for what? He said, 1 cup of this is going to cure hypertension. I said, Allahu Akbar. I said, what about your medications? They know it's snail water. It works well. We have, unfortunately, it did not work. I won't tell you the remaining story, but I thank God it did not take her away. So a good number of patients, one of the very key problems is skipping medication or transiting from the orthodox medication to herbal medications that are not confirmed. Not confirmed, not trusted. Everybody comes to the TV, YouTube, or anywhere and gives lecture. I've made this discovery. You take this, it will clean your vessels, it will do this. Where is his laboratory? Where was the research conducted? Nobody knows. And then to worsen it, if he's a Muslim, then it tells you, call Allahu or call Rasulullah sallallahu alayhi wasallam. Then the Muslim gets, oh, Allah Akbar, this is the revelation from God. And then if he's also a Christian, it tells you, oh, I'm a man of God. Shout hallelujah. Give the Lord a wiper. The Lord is good all the time. Now, Nigerians, he will just keep his drugs, medications, and switch to the holy water or to the herbs described as a prophetic medicine. And before you know it, stroke comes, heart attack comes. Another important thing that causes this problem is poor diet adherence. Many of us, they tell you, these are the diet you take. You tell an individual, reduce your salt intake. Then what does he do? He becomes a bread eater. Bread has huge amount of salt. So he takes bread in the morning, bread in the afternoon, bread in the evening, and comes to the clinic and says, no, I don't take salt. How about the bread? So you don't add, so a good number of people do not adhere to the diet prescription. Number three, people ignore even measuring and monitoring their blood pressure. You tell a patient or an individual, a client, will tell you, say, I don't want to know the figure. I don't want to know the figure. It gets me disturbed when I know about it. So your blood pressure is 220. You say you get disturbed knowing about it. Then how do you solve the problem? Another thing is stress mismanagement. A good number of us, you can't be in Nigeria without stressing. Even in the advanced countries, you're going to stress. but you got to manage it appropriately. Make a schedule, create a timetable, and ensure you sleep at least 6 hours. Ignore unnecessary things. Focus on major things that have impact on your life. Thank you.
Thank you so much, Doctor. Again, I love the humor infused lecture. I would always say this because it helps us to seek better. So really thank you, and for, of course, for keeping it very short, simple and succinct. So really well done. Thank you so much, sir. Before I go to my next question, we're going to be rounding up very shortly. I just wanted to say, I congratulated you earlier on thinking it was you. But this is us being super futuristic because we know that inshallah it will happen to you very soon as well. But I would like to congratulate our chairman, the chairman of the Sakina Medical Outreach, Dr. Salman, who has been recently elevated to the rank of Associate Professor of Neurosurgery. Please, those of you that
MashaAllah.
dropped your congratulations earlier on, please drop it again. Our chairman is now an associate professor. It's
Alhamdulillah.
it's plenty book, oh. Plenty hard work. So really well done, sir. Mashallah to you. And
MashaAllah.
these kind of news, they make me very excited, because I know that sometimes when people talk about Islam, when they talk about Muslim, they just flow with propaganda, but we do incredible work, and the world needs to know the amount of work, the amount of contribution we're making to humanity. So really thank you so much, sir. And when I talked about what those persons are doing earlier on for the Sakina Medical Outreach, you can tell now that it's so much work, it's so much effort, and it's so much resources they are putting into making the organization run. Imagine being an associate professor, with the plenty books they are reading, having to sometimes also, address issues, talk to clients and all of those things, and they still have time to be doing the work at the Sekina Medical Outreach. So really thank you so much, sir, and well done. We know that very soon you're going to go higher and higher and higher, bi'idnallah. Well done. We are very proud of you. We will be rounding up very shortly, like I said earlier on, but I just want to encourage the persons on this call and those that will probably listen to this much later. Please support the work that we do at the Sakina Medical Outreach. My colleague will drop our account details on the chat very shortly. Donate, nothing is too small. If you cannot, also spread awareness about what we're doing. Help us share the account details. Follow us on social media at Sakina NGO. We also have a website. Just engage with us, stay connected. We do a lot of amazing work, and it helps that we get these to the outside world as possible, and it helps that we get this to the outside world as necessary. So really thank you so much, and congratulations once again to Dr. Salma, now Professor. Inshallah. Well done, sir. So my next question to you, I was gonna ask you about the ABBA, the concussion, but I like that you already spoke to that already. So if you want to do that, you need to ensure that it is tested and trusted. Don't just trust people who say, go and add salt, plenty salt to water. It will cure this, it will cure that. It's not going to work. So seek medical advice, speak to professionals. It is very, very critical. So my next question is on affordable lifestyle changes that people should make. Because when we talk about being health conscious, we know that it can be quite expensive sometimes, and it can also be time consuming. So for people who say, well, I do not have the time, I have to work, otherwise my children, my family can eat, and we do not have the money as well, what do you advise this kind of people? And doctor, before you respond to this one, there's a comment as well in the chat, a question actually. Somebody is saying that the consumption of food, for example, like pap, fufu, etc. Some say these are far more beneficial to our health than others. Can you shed some light on this, please?
Oh, thank you very much. I think, Alhamdulillah, you have discovered my brother who got the promotion. So, Dr. Salman, Barakallah Fik, may Allah make it easy. May Allah bless it for you. Yeah. So, in Nigeria, our food is mainly starch-based. In every section of the country, carbohydrate is our major food, from fufu to eba to amala to pounded yam to tuwo, and they're all categories of tuwo. They're all starchy foods. But the teaching, we say, you can't really abandon the starchy food. It's everything in moderation with increased amount of vegetables and proteins. That's what we teach. Less amount of sugar, less salt. So what we talk about is less the sugar, less the salt, less the calorie intake, take more vegetables, take supportive proteins, reduce the cholesterol intake, and it's going to really help you so much. For those ones that have love for alcohol, you're going to stop it, then manage your stress well. You can do some meditation, some yoga, then do at least every day, take a walk. You know, when the Prophet ﷺ said, you work to Juba to eat and follow another way back, they think it's a joke. Now we know that at least we're able to exercise for 30 minutes every day. It's going to help you so much. Yeah, it's going to help you so much. So you try to ensure that at least every day. I always encourage my patients, start little and grow gradually. Don't go day one doing 40 minutes exercise. You're going to collapse because your system is not used to it. So I always teach a gradual, incremental exercise. So they just start gently. You've not done exercise before. You've always been sitting down. Okay, fine. So this week, you've committed yourself. You want to start. Okay, start 5 minutes. Take your time. Walk from your house to the bus stop or wherever. You're going to have steps counting or timing. Just time yourself. Okay, I want to do for 5 minutes. Then you do 5 minutes. It's okay. Take a shower and go to your work. Then maybe next 2 days, another 5 minutes. Your body gradually adjusts. Then you increase. What are you increasing? That is one of the essence of follow-up at clinics. Some clients who come to clinic and then they don't come again because they feel I've already gotten the medications. I don't need going back there until the day I'm sick. No, clinic visit is not meant only for managing emergencies. Even your wellness needs to be measured and you are assured that you are okay. So these are some of the things we do. So like I've mentioned earlier, take fruits, take vegetables, and whole grains. That's a very good thing. Whole grains. You see, a good number of time, the semo or wherever we take, they are so fine, and you know they've been polished. Those grains have been polished, and so the back, you know, of these grains have been removed, and which are actually protective and reduces the rate of absorption of glucose post absorption or post ingestion. You know, because one of the problem is what you call the postprandial glucose rise, the glycemic index. It causes the real trouble. But there are food that when you take them, like you're preparing your maize, don't peel the back off. That's what we do. Just like we were preparing kose or akara, you see, we got to first of all soak it, remove the back, and then so that we can get very pure, smooth food. You do that to maize, you do that to wheat, you do that to rice, and that is the problem. Leave the bran there. Leave it there. Yes. Blend everything together. It helps. It reduces the rush of glucose into the system. It releases the glucose in gradual quantiles, and that helps to individuals. So this is what we tell people. So when you buy your maize, grind it that way and use it for your semo or wherever you're taking. You get your rice, go and buy natural rice in Nigeria. That is one of the good things that the Buhari administration taught us. Eat your own rice, not this polished rice that are coming causing us diseases. So you produce your rice, you don't have the technology to polish it. Very good. That is what is good for your health. And when we do this, it's going to reduce a lot of the problems and ensure you monitor your blood pressure and blood glucose regularly as told to you by your health professional.
Thank you so much, Doctor. I just learned something now. Even though I'm not a fan of moi moi, but I know that I will not peel the beans when I when I manage to cook it. So really, thank you so much. There's a question from Alhaja Igbeyemi. She says, "Assalamu alaikum, sir. I really enjoyed this. Please, sir, kindly advise if juicing fruit is better than taking it straight.
If what?
If juicing, if juicing fruit is better than taking it as a whole."
Juicing fruit.
Yeah, did you get questions, sir? So, for example, if you buy a pineapple, rather than just eat it that way, should you juice it? Is it better to juice it, or should you eat it that way?
Well, it's better to eat it the way it has been produced, actually. A good number of times, the transformation from one point to the other brings in different things. If you have
Mm.
your orange, for example, we say peel the back and eat everything inside. It helps you. You're taking your apple, just eat your apple. But of course, if you blend only that and then you take it also, it's okay. But of course, preservation becomes an issue. The machine you use to juice it becomes an issue. So a lot of things happen. But you get your fruit, you wash, like we always say, maybe with some salt, some little salt added to water to make sure there are no worms or bacteria on the back of the fruit, and then you take it that way. It's good. It's natural. One of the very good things is we tell people, take these things together as a family, cook together, eat together, less salt, less sugar. Don't be doing individuals eating in the home. Just cook together. Cook your food, reduce the salt, reduce the sugar, bring the fruit on the tray, use your knife, cut it into pieces. Everybody eat, alhamdulillah. It's going to help the people, really.
Thank you so much for that response, sir. Before we take the next one, I want to quickly acknowledge our Director of Operations at the Sekina Medical Outreach, Professor Nasser Abdul Rashid. Thank you so much for joining us, sir. Good morning and salamu alaikum to you. Thank you for all you do at the Sakina Medical Outreach as well. Thank you, Doctor. Just to add very quickly to what you have said, because we had a session, I think it was for the second quarter of our Sakina quarterly health talk, where our speaker then talked about juicing and not juicing. I think one of the things she said, if my memory serves me right, is also she encouraged us rather to eat as a whole for the most part, just like you have said, rather than juice. Because oftentimes when you buy a pineapple, if you eat a slice, you're okay. But if you want to juice, you can't juice just that slice. You have to juice like the entire pineapple, and that is you consuming more than your body actually needs at that time. So to Alhaja, I'm not a medical practitioner now. I'm only responding based on what our previous speakers and of course what doctor said as well. So there's a question on what is being done to lighten the burden of cost of care for hypertensive patients.
Oh, mashallah. What is being done to lessen the cost? Yeah, what is being done is what we are doing now. Because one of the very important things that will reduce the cost of the cost burden on individuals is to prevention is better than cure. And then there is primary, secondary, tertiary prevention, and even before the primary. So when you are aware of this information, you sleep well, you check regularly, you eat well, you cook together in your house. You're a family of 6, a family of 7. Not everybody cooking his own and putting different amount of salt unregulated. You're already preventing trouble. Even if you are still hypertensive, the way it will be managed would not be like the one that comes with a stroke, would not be like the one that has come with with a kidney failure, would not be like the one that has come with heart failure or heart attack. Because because this sickness or this condition, sorry to say, usually would progress with carelessness or with not obeying or following the rules. And when it progresses, of course, the cost burden increases. So from being hypertensive, for example, we may say, okay, avoid 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 salt, reduce your salt consumption, leave your sugar consumption, reduce it, take more vegetables, reduce your calorie intake. You know, I've been giving you this advice because, like we should know, a heavy population is hypertensive. About 30 to 40% of us are hypertensive in the country. And for diabetics, about 50 to 60% of them are hypertensive. So you can see that there is a risk, a great risk. So if you're hypertensive and diabetic, that is double risk. You're hypertensive, you can become diabetic. You're diabetic, you can develop hypertension. So whichever the case, if you come to clinic on regular follow-up, number 2, take your medications. Number 3, check your measurements regularly. If it is normal, many would say, okay, you do it monthly. I tell people, the guidelines are meant to guide. But from what I've seen in clinics, tell people, don't even wait for a month, every month to check your BP. What stops you from checking every morning before you go out? What stops you? This is your health. Why do you need to wait for 3 months? Anything can happen at any time. And then before you know, trouble has set in. So if you are able to obey the rules, reduce the risk, the expenditure on health will get less. That's one part from your side. The other part, which is supposed to be from the government, that one too. God guide them. I always say something, if the government can make 2 or 3 medications, for example, just pick one drug from each class, let's say lisinopril, for example, amlodipine, for example, and Benadryl, and take it as a national priority, make these drugs free, so that both at private facilities and public facilities, they are free. So nobody will steal it from public to go and sell at private, because everywhere will be free in the country. This will reduce the burden of the complications of hypertension. The same thing to diabetes, just provide metformin and glimepiride, for example. Flat across the country. Our government can do this. We can just decide that, okay, pick 1/10 of the gold reserve in Zamfara and use it to subsidize this for the country. Or pick some limestone in Kwara or some tin in Plateau and use for this. And everybody will be safe. But that is what government can do. We as health practitioners, we can only counsel. We can only counsel you, okay, do this, avoid that. But the policymakers, I hope they listen to us, and then they can take that decision up there to reduce the burden, the cost burden, because a good number of patients really find it expensive to manage, especially those with complicated hypertension or those with hypertension that is non-responsive to the normal small, cheaper medications. Some patients have to be on 3-4 medications because they have resistant hypertension. And for those category of patients, you can see sometimes the cost of the medication is ×2 their monthly salaries. So these are the people that people need to assist.
Jazakumullah khairan, Doctor. The final question for you, sir, which I would want to also kindly ask, that you tie to one message you think families should take away from today's session. So, Ajia Hamina Tumar is asking, what should be the interval of our meals? I believe you understand this question. It's not very clear to me, but maybe you do, sir.
Come again with the question, please.
He's asking, what should be the interval of our meals?
Interval of meals, generally, we know that digestion time generally should not go beyond 4 to 6 hours. If you have eaten food, we expect that the food digestion and movement out of the stomach should be 4 to 6 hours. And that is what determines that, okay, fine. And then after 6 hours, you're expected to 6 to 8 hours, you're expected to consume the next meal. And that's what we talk about, the 3 triangular meals. Even though they call it square meals, I don't believe it's a square, because square has 4 angles. So there are 3 triangular meals. So I think that is a better one. because they just play the, okay, 4 to 6 hours, 4 to 6 hours, 4 to 6 hours. So you take your breakfast, your lunch, and then your dinner. What I always advise, just like what the Sunnah says, is when you are still filled, you don't eat. You don't eat. That is one. If you discover that you eat food and your stomach is heavy, you're having indigestion, don't load another one on it. It's going to bring disease to you. Number two, don't take your meal too late. This advice we always give to patients or clients, but even though we practitioners don't obey it, astaghfirullah, because our work schedule is so terrible that sometimes the time you have to eat is midnight, so you have to eat rather than dying of hunger. But for the general population, you should eat before you go to bed. Should be about 3 hours, 4 hours before bedtime, 2 to 4 hours before bedtime. So that your food at least as going down, to speak local language, before you go to bed. That's a very important one. So I think the important thing here, the single action we can do as a family, is that we cook together, like I mentioned earlier, cook together, eat together with less salt. Thank God it's a woman that is asking the question. So as mama of the house, you are the manager of the kitchen. Ensure that you cook together, everybody eat that cooked food. If it requires putting it in a tray, put it in a tray and let everybody surround that tray and eat together. No extra salt, no extra sugar. And then once you prioritize home-cooked, balanced meals, it will solve a lot of problems. All these canned food that people are eating, processed food people are taking, junks that you call it all over the place, they are the real troubles affecting our health. I pray that we would understand better than it has been explained.
Doctor, you're a blessing to the human, to the world in general. Thank you so much for being very generous and very kind. You know, it's one thing to know something, it's another thing to want to share it with the world, and for free at that. Thank you for not only consuming the knowledge, but producing the knowledge. And you're producing the knowledge not only in the hospital, but also in forum like this. Thank you so much. We're grateful. You could have just said, oh, this morning I want to sleep because, I mean, it's been a long week. But out of the abundance of your spirit and personality, you said, no, this session is very important and I will be there. We do not take this for granted. Thank you. May you continue to be a source of blessing, of joy, of pride, not only to the Ummah, but to the entire world. Thank you,
Ameen.
Doctor. We can't thank you enough. Jazakumullah
Ameen.
khairan. Thank
Ameen.
you.
Ameen. Thank you
So
very much.
you're most welcome, sir. Before I call on the latest associate professor in town, for his vote of thanks, I just want to kindly remind you that the Sakina Medical Outreach, like you already know, does a lot of fantastic job. And we can't do this thing alone. It's so much. You know, the resources that we require, they are huge. And we need your support to really move this forward. So please support us. My colleague already dropped the account details on the chat. You can see it there. And like I said earlier on, we're also very active on social media. Please follow us on social media. Everywhere we are Sekina NGO. Spread the word about the incredible work that we are doing at the Sekina Medical Outreach. We need to provide medical assistance, medical interventions to many Nigerians. The numbers that I read earlier on, they are big numbers, but we can do better. And we know that we can count on you to help us make more impact, not just in Nigeria, but across the world. So please donate. If you cannot donate right away, we understand. Make sure to copy the account details, donate to us later on, share with your contact. You never know, you just never can tell who can support our cause. But importantly, make sure that you're doing something to uplift the Ummah. And thankfully, the Sakina Medical Outreach is there to make it easier and more seamless for you to do. Thank you for doing that. And we truly appreciate that we can always count on you. Thank you. So right about now, I will call on our chairman, the man who has been providing stellar leadership to make things run very smoothly. Is not just a man in the classroom or in the hospitals, but also in the corporate world. He is making all of us very proud. And when we are calling on Muslims who can serve as role models, we can always look back and say, yes, that is Associate Professor Salman Yusuf. Please, if your hands are not busy, I know you can't clap right now, but use the chat, use the emoji, drop it there. Give our chairman, the newly elevated Associate Professor Salman Yusuf, a rousing applause. Don't clap so that this place will not be rousing, but drop it in the chat. Thank you so much for your leadership, sir, and over to you for the vote of thanks.
Assalamu alaikum warahmatullahi wabarakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Thank you, Rafiat, for the good job. And a special thanks to Dr. Mustafa Yakubu for the excellent delivery. Jazakallah khairan. I think today's session has been very enlightening, both for medics amongst us and the general populace, young and old. I thank everybody that participated. One thing that I think we'll take away as an organization from this lecture is to expand our scope of interventions. Yes, we seek support from populace, but again, we also like to encourage all of us. If you have anybody that is in need of medical assistance, to apply for it through Sekino Medical Outreach. And within the limit of our resources, we'll try as much as possible to attend to all applications. So let's spread the news about not just donation, but also seeking medical assistance through Sekino Medical Outreach. The other thing I will say based on this lecture is that we are going to look at having directories of chronic diseases, like we'll take one at a time. Hypertensive patients, diabetic patients, who probably develop a list that of patients or individuals, not necessarily patients now, that will be getting support from Sekino Medical Outreach. Well, you can see from the lecture, one of the reasons for non-compliance is lack of resources to get this medication. And realistically, we know that the government focus is not on that direction for now. So as individual organization, we will need to put that after giving the enlightenment, and people wants to get the medication, which also find the way of supporting. So the board of Sekino Medical Outreach will look at a chronic disease directory. That I don't know. That is just coming like an impromptu decision from me. Then we'll have a list of people who will be supporting maybe on monthly basis, quarterly basis, with supply of their medications. Inshallah, we'll look at that. I'm happy that Dr. Professor Nasir Abroshid is on this call too. So he's the director of our operation. He will also look at that. I thank Alaja Egbemi for all the leadership role she has been playing in this Sekino and other activities that we do, both at impact level and at Sekino level. Thanks everybody. Jazakallah khairan. Assalamu alaikum.
Walaikum assalam. That's our chairman, the newly elevated. I'll keep saying this because it's not easy. The newly elevated associate professor. You see, when you talk about a leader who does not just listen but takes action, you need to point to him because of the lecture that he had today. Now he has decided on certain things, and that's how leadership should be. Leadership should be very swift. It should be very proactive and sometimes also reactive. So well done, sir. Thank you so much. And once again, congratulations to you and well done to the entire team at the Sakina Medical Outreach. I want to also say Thank you so much for always having me. I enjoy being a part of the family, and inshallah next year I can be more into the family, not just hosting your virtual sessions, but also contributing in much more meaningful ways. Thank you so much. Once again, my name is Rafiat Atonda. I am a communications specialist, and I also teach public speaking online and offline. So inshallah, we're going to be doing more next year together. And happy new year in advance. Not Islamic year, obviously, but happy 2026 in advance. Thank you so much, and enjoy the rest of the Sunday and the new week. Salamu alaikum.
Wa alaikum salam to Allah.
Wa alaikum salam.